Somewhere in your house right now, there's a product you bought because the label said it would help your body get rid of something. A tea, a powder, a bottle of dark juice with a leaf on it. Maybe you bought it after a holiday weekend, or after a stretch of eating that left you feeling sluggish, or after scrolling past someone on social media who looked radiant and credited a 7-day cleanse. You are not gullible for buying it. You are a normal person responding to a very well-funded message that has been repeated in various forms for over a century. But the message is wrong. And the reason it is wrong is more interesting than the marketing, because what your body actually does every second without commercial assistance is one of the most sophisticated chemical operations in biology. Let me tell you about your liver. It weighs about 3 pounds. It is the largest internal organ you have, and it runs, conservatively, over 500 identified metabolic functions simultaneously. Among those functions is a 2-stage detoxification process that pharmaceutical researchers have spent decades mapping, not because they wanted to sell you a supplement, but because understanding it is essential to knowing how drugs, alcohol, pollutants, and your body's own metabolic waste get processed and cleared. Stage 1 is called Phase 1 metabolism. It is performed by a family of enzymes called cytochrome P450, about 57 functional genes in humans, that take fat-soluble compounds and chemically transform them into water-soluble intermediates through oxidation, reduction, and hydrolysis. A 2013 review in Pharmacology and Therapeutics confirmed that this enzyme family metabolizes roughly 75% of all pharmaceutical drugs. One single isoform, CYP3A4, handles about half of all medications on the market. This is not a fragile system waiting for celery juice. This is an industrial-scale chemical processing operation that has been refined over hundreds of millions of years of vertebrate evolution. But Phase 1 is only the first step. The intermediates it produces are sometimes more reactive than what you started with. That is why your liver runs Phase 2. Conjugation. Phase. Enzymes attach large polar molecules to those intermediates, making them water-soluble enough for your kidneys to excrete them. There are 6 major conjugation pathways: glucuronidation, sulfation, glutathione conjugation, acetylation, methylation, and amino acid conjugation. Glutathione conjugation is particularly important. Glutathione is your body's primary endogenous antioxidant, and your liver synthesizes it from 3 amino acids without supplementation. A 2010 review in Biomedical Papers documented these pathways in detail. They work continuously. They do not require a reset. And then there is what has more recently been called Phase 3, membrane transporters that actively pump the finished water-soluble waste products out of liver cells and into bile or blood for kidney excretion. Your liver does not sit passively. It runs an assembly line with a loading dock. Now, consider your kidneys. Each one contains approximately 1 million nephrons, tiny filtration units. Together, they filter roughly 180 liters of blood plasma every day. That is 47 gallons. Picture 47-gallon jugs of milk lined up on a counter. That is the volume your kidneys process in a single day. Every day, reabsorbing 99% of the water and returning it to your blood, while routing the waste, urea, creatinine, uric acid, and all those conjugated metabolites from your liver, into 1 to 2 liters of urine. This is described in every edition of Guyton and Hall's Textbook of Medical Physiology, the standard reference for renal physiology since its first publication. No supplement accelerates glomerular filtration rate in a healthy person. No tea makes your nephrons work faster. The system operates at the pace set by your blood pressure, your renal blood flow, and the structural integrity of those million nephrons. It does not need help from a tea bag. That is what is actually happening inside you. Now let me tell you what the industry is selling instead. An estimated $50 to $75 billion a year flows through the global detox product market. Teas, juice cleanses, charcoal products, colon hydrotherapy sessions, foot pads, supplement capsules, infrared wraps. The exact number is imprecise because detox is not a regulated product category. It is a marketing word applied to everything from a $4 teabag to a $15,000 residential retreat. And every one of these products rests on a single premise: that your body is accumulating unnamed substances it cannot handle alone. Here is what is remarkable about that premise. In 2009, a UK science charity called Sense About Science contacted 15 manufacturers of detox products and asked each one a straightforward question. Which specific toxins does your product remove? Not one could answer. Not one could name a single substance. Not one could provide clinical evidence. The word toxin in marketing is deliberately unspecific. It sounds clinical, it implies danger, and it commits to nothing testable. This matters, because the moment you ask for specifics, the entire category collapses. Take detox teas. The majority contain senna leaf, an FDA-approved over-the-counter stimulant laxative. Senna contains compounds called senosides that are broken down by colonic bacteria into a substance that stimulates your large intestine to contract and inhibits water absorption. What this means, practically, is that the tea makes you go to the bathroom. The weight that drops on the scale is intestinal contents and water. A 2001 review in Diseases of the Colon and Rectum documented that chronic senna use can cause electrolyte imbalances, particularly low potassium, which can cause cardiac arrhythmias. The weight returns within 48 to 72 hours because it was never fat. It was never accumulated poison. It was water. The other common ingredients, dandelion root, which is a mild diuretic, meaning it makes you urinate more, do the same thing from the other end. More fluid out. Temporary scale change. No toxin removal. And milk thistle, often marketed as liver support, was tested in a rigorous NIH-funded trial published in JAMA in 2012. The result: no significant benefit in patients with hepatitis C. If it does not help diseased livers in a controlled clinical trial, the suggestion that it supercharges healthy ones is a stretch the evidence does not support. Take juice cleanses. A 2015 systematic review in the Journal of Human Nutrition and Dietetics looked for controlled clinical trials demonstrating that commercial detox diets remove toxins from the body. They found none. The review's conclusion was direct. The small number of clinical studies and the absence of controlled trials make it impossible to confirm that these regimens do what they claim. What juice cleanses do accomplish is caloric restriction, typically 800 to 1200 calories a day, combined with glycogen depletion. Glycogen, the stored carbohydrate in your muscles and liver, binds about 3 grams of water for every gram stored. When glycogen drops, the water goes with it. The scale moves. It is not detoxification, it is physiology. And those headaches, that fatigue, those skin breakouts people experience during a cleanse that marketers call a healing crisis, or evidence that the toxins are leaving. A 2004 review in Psychopharmacology established that caffeine withdrawal headaches begin 12 to 24 hours after last caffeine intake. That is what is happening. Hypoglycemia from caloric restriction causes the fatigue. Dehydration contributes to the skin changes. The healing crisis concept sometimes called a Herxheimer reaction, is a real immunological phenomenon, but it occurs during antibiotic treatment of specific infections like syphilis, as a 2017 review in Clinical Infectious Diseases documented. It does not occur during juice fasting. The body is not purging. It is hungry, dehydrated, and missing its morning coffee. Take activated charcoal. In an emergency room, it saves lives. Administered within 1 to 2 hours of an acute oral poisoning, at doses of 50 to 100 grams, its enormous surface area, roughly 3,000 square meters per gram, absorbs many toxins in the gastrointestinal tract before they can be absorbed. This is real medicine, but its mechanism is indiscriminate molecular binding. It does not distinguish between a poison and your blood pressure medication. A 2010 review in the Journal of Medical Toxicology and an FDA safety communication in 2018 both noted that activated charcoal can interfere with medication absorption, including oral contraceptives, antidepressants, and cardiac drugs. The consumer products, charcoal lattes, charcoal ice cream, charcoal capsules, deliver 1 to 5 grams. The clinical dose is 50 to 100 grams. The consumer dose has no demonstrated systemic detoxification effect. It is a photo opportunity in a glass. Take colon hydrotherapy, the modern name for colonic irrigation, which is the modern name for the enema repackaged as a spa treatment. A 2009 review in the American Journal of Gastroenterology found no evidence of therapeutic benefit. A 2011 review from Georgetown University's Department of Family Medicine, published in the Journal of Family Practice, found no methodologically rigorous controlled trials supporting it, and documented adverse effects, including bowel perforation, infection, electrolyte imbalance, and renal failure. The colon does not accumulate years of waste. Normal intestinal transit time is 12 to 36 hours. What goes in comes out. The system works. And the foot pads, those adhesive patches you stick to your soles overnight that turn dark brown by morning, allegedly drawing toxins through your skin. The brown color comes from a chemical reaction between wood vinegar in the pad and moisture from your sweat. Multiple independent investigations, including one by NPR in 2008, demonstrated that the pads turn the same color when dampened with plain water and left overnight. No foot required. Here is where I want you to pause, though, because the history changes the way this story feels. The idea that the body poisons itself through its own intestinal waste is not new. It dates to ancient Egyptian medicine. It was formalized in 19th century European medical theory under the name auto-intoxication. By the early 1900s, Nobel laureate Elie Metchnikoff promoted the theory that colonic bacteria produce toxins responsible for aging and disease. Surgeons, real surgeons, in real hospitals, removed sections of healthy colon to cure it. By the 1920s, the medical establishment had largely abandoned the theory, as a landmark 1919 paper in JAMA by Walter Alvarez documented. The evidence did not support it, but the commercial apparatus kept going. Patent medicine advertisements from the 1890s and 1900s sold blood purifiers and colonic lavage with language nearly identical to what you see on Instagram today. The pitch has not changed in 130 years. Only the packaging has. The modern detox industry exists in its current form because of a specific piece of legislation. In 1994, Congress passed the Dietary Supplement Health and Education Act, DSHEA. Before DSHEA, supplement manufacturers had to demonstrate that their products were safe and effective before selling them. After DSHEA, the burden flipped. The FDA now has to prove a product is unsafe after it is already on the market. Products cannot claim to treat or cure disease. That would make them unapproved drugs. but they can make structure-function claims. Supports liver health. Aids in natural detoxification. Vague enough to evade enforcement, specific enough to imply therapeutic benefit. The supplement industry went from $4 billion in 1994 to over $55 billion by 2023. The detox segment grew inside that expansion. Now, there are two things I want to hold alongside everything I have just told you because honesty requires them. First, environmental chemicals are real. The CDC's National Report on Human Exposure to Environmental Chemicals, updated through 2023, documents measurable levels of hundreds of synthetic compounds in the U.S. population: PFAS, phthalates, organophosphates, heavy metals. These are not imaginary. The scientific question is not whether these chemicals are present, they are, but whether commercial detox products remove them. No evidence suggests they do. The evidence-based approach to environmental chemical exposure is regulatory reduction of those chemicals at the source, not retail products applied after the fact. Second, autophagy, cellular self-cleaning, is genuine science. Yoshinori Osumi won the Nobel Prize in 2016 for elucidating the mechanisms by which cells degrade damaged proteins and organelles. There is preliminary research exploring whether intermittent fasting may enhance autophagy in humans, as a 2019 review in the New England Journal of Medicine by DeCabo and Matson discussed. But this is early-stage research in humans, not a validated commercial application. The detox industry has seized on autophagy the way it seizes on every piece of legitimate science, extracting the language, discarding the caveats, and attaching a price tag. The National Institutes of Health, through its National Center for Complementary and Integrative Health, stated it plainly in 2019. There isn't any convincing evidence that detox or cleansing programs actually remove toxins from your body or improve your health. Edzard Ernst, Emeritus Professor of Complementary Medicine at the University of Exeter, drew the line that matters. There are two types of detox. One is the treatment for life-threatening drug addiction. The other is the word being hijacked by entrepreneurs to sell you things. The real detoxification in medicine, the kind that happens in hospitals, is activated charcoal at clinical doses for acute poisoning within a specific window. It is chelation therapy for confirmed heavy metal exposure, administered by physicians who can measure the metal levels before and after. It is supervised withdrawal protocols for alcohol and opioid dependence, managed in clinical settings with vital sign monitoring. These are medical interventions. They are not available in a bottle at the grocery store, and they should not be. If you have bought a detox product before, there is nothing wrong with you. You responded rationally to a sophisticated marketing message that exploited a genuine anxiety. The feeling that modern life puts things in your body that should not be there. That feeling is not entirely wrong. The solution the industry offered, though, does not address it. Your liver addresses it. Your kidneys address it. They have been addressing it since before you were born. Pattern beats product. Every time. If you are managing a specific health condition, liver disease, kidney disease, diabetes, anything that affects how your body processes what you eat and drink, the partner for that conversation is not a label. It is a registered dietitian. That is the credential to look for, RD or RDN. In many states, anyone can call themselves a nutritionist. A registered dietitian has specific clinical training, specific licensure, and specific accountability. For individualized guidance, that is the professional. For everyone else, the evidence points where it has pointed for decades, toward broad dietary patterns rather than individual products. Adequate hydration, sufficient fiber, a generally varied intake of whole foods, whatever your cultural tradition serves. Your grandmother's cooking was not wrong because it was not optimized. Food is culture before it is chemistry. The Italian dinner, the Mexican Sunday meal, the Indian home kitchen, the Southern table. These are not problems to be solved by a cleanse. They are how people have eaten, well, for generations. The next time you see a product that promises to rid your body of unnamed substances, ask the question that Sense About Science asked in 2009. Which toxin? Specifically, what is its name? What is the mechanism of removal? How was this measured? No one in the industry has ever answered that question. Your liver runs 500 operations at once. Your kidneys filter 47 gallons a day. These systems do not need a reset. They do not take weekends off, and they have never once required a purchase. Comment with the nutrition claim you have heard most often that you suspect does not hold up. The one that nags at you, but never quite made sense. If this is the version of health content that treats you like an adult, subscribe for more evidence without the sales pitch.